Thank you all for joining us today, this HumanKind presentation of social connection and health, exploring the intersection of barriers. Throughout this year, we have been exploring the topic of overcoming loneliness in our HumanKind series, and we've focused with a lot of different lenses. Today, our lens will not only be that of public health, but also looking at those that are marginalized or on the fringes of our community. And I'd like to welcome and thank our presenters today. They can take it away.
Next slide, Donna. We are your presenters for today. I'm Erin Oleniczak, a health planner with District Health Department number 10, and I serve as backbone staff for the North Central Community Health Innovation Region. And then I will let Kianna and Donna introduce themselves and talk a little bit about how our interests in work and social connection started.
Good afternoon, everyone. I'm Kianna DeHoek. I am a health educator at the Central Michigan District Health Department, and I also serve as backbone staff for the North Central Community Health Innovation Region.
Hello, everyone. Glad to be here. And my name is Donna Norkoli. I'm the Regional Planning Manager at District Health Department 10 and backbone staff to the North Central Community Health Innovation Region. And we recently were awarded some funding. So we decided to use some of that funding to bring social connectedness workshops to our region for our steering committee for the North Central Shire. And so that's where this came from. We contracted with a group called Healthy Places by Design, who focus on helping communities promote social connectedness.
So what if there was something that can transform our community's whole health and well-being? Strengthening social connections can help us achieve that. Social connection is often experienced through feelings of closeness and belonging. Connection is found through rich social networks with a variety of people who offer support in times of need and whose relationships satisfy us. Donna, if you move the slide forward, it'll bring up some more information. Oops, I'm sorry. Go back to the last slide, sorry. Oh, community social connection is a powerful force that links people, groups, and society through collaboration and shared goals. Studies have found that strong social connection can boost individuals' odds of survival by 50%. The link on the middle of the screen, the Action Guide for Building Socially Connected Communities, was developed as a resource to provide actionable steps for communities to strengthen social ties and foster connection. It was developed by the Foundation for Social Connection, and we can also share the link in the chat for you to access that as well. Next slide. In 2023, the Surgeon General released a report on the epidemic of loneliness and isolation. This report can be found online in a PDF report format, and we can also share the link in the chat as well. Loneliness and isolation represent profound threats to our health and well-being, but we have the power to respond by taking small steps every day to strengthen our relationships and by supporting community efforts to rebuild social connection. We can rise to meet this together, and we can build lives and communities that are healthier and happier, and we can ensure our country and the world around us is better poised than ever to take on the challenges that we face. Within the Surgeon General report, these data points that are on the slide can be found, as well as several others. And through studies and research done, it was found that lacking social connection is as dangerous as smoking up to 15 cigarettes a day. In addition to that, poor or insufficient social connection is associated with the increased risk of disease, including a 29% increased risk of heart disease and a 32% increased risk of stroke. It is also associated with the risk for anxiety, depression, and dementia, and the lack of social connection may increase susceptibility to our physical health, including respiratory illness and other illnesses. When individuals have high-quality social connection, it helps to protect against heart disease, dementia, and Alzheimer's, reduce levels of depression, anxiety, and stress. It helps our youth to succeed in school and make it easier for employees to create a healthy work-life balance. Social connection also plays a crucial role in our community's health, safety, and success. Belonging and civic engagement are crucial for thriving communities. This slide shows some ways that we can or do already socially connect. Through marriages and family relationships, our friendships, participation in community life, including school extracurricular activity, sports teams, hobby groups in our communities, veterans groups, religious communities, and volunteering. Civic and political participation, so voting, community service, or running for local office, and then our connections in our neighborhoods and communities. From the moment we're born, we experience relationships, and from an early age, these relationships help us grow, develop, and learn about ourselves and the world around us. In each stage of our life, relationships are critical for flourishing, health, and well-being. And I'm going to pass it over to Kianna to talk about some local efforts that have taken place in our region that helped us to understand the need for social connection.
Thanks, Erin. So in 2023, with the support from a CDC Social Determinants of Health Accelerator Planning Grant, the North Central Community Health Innovation Region conducted in-person focus groups in Lake County, Mecosta County, Clare County, and Isabella County. Overall, we connected with 44 residents via in-person focus groups, and this slide shows the methodology used to recruit participants to the focus group. We wanted to keep it as client-centered as possible, so we did offer participation gift cards. It was child-friendly. Participants were welcome to bring their children. It was located in centralized spots with local community-based organizations. We provided food, of course, and gas gift cards were also given, as well as on-site recruitment took place. The purpose of the focus groups were to connect with residents across varying demographics, including seniors, parents with young children, and individuals with disabilities, to hear about their experiences related to forming social connections and accessing healthcare. Our goal for gathering the data was to identify barriers in forming or maintaining social connections. Recognizing barriers to social connectedness is crucial, as it enables us to address and overcome the factors that hinder meaningful relationships, fostering a more inclusive and supportive society where individuals can thrive together. And specifically, the focus group data identified needs and helped us develop our SDOH accelerator plan with goals and objectives to address social connectedness. An impact of our research was a development of a work plan with social connectedness prioritized strategies, which include the improving the accessibility of events, programs, services, and community spaces, making social connectedness a community norm, and reducing stigma associated with disability, mental illness, and substance use. So I will get into some of the data that was collected through these social groups. The barriers that came up are separated by each demographic. So under seniors, some of the barriers that kept coming up was accessibility, transportation, internet access, cost, and awareness and knowledge. For parents with young children, it was support networks, so people who could watch children for them to attend medical appointments or social gatherings, transportation, community resources, community events, just a lack of events, and then the awareness and knowledge as well. And for individuals with disability, it was finding community, finding other people like them, accessibility, cost, transportation, stigma, and awareness and knowledge. And on the next slides, we have some quotes from participants from the focus groups. For our seniors, their quotes were, "A lot of times I just don't go because it's hard for me. A lot of days I just walk to get around. I'm not really outgoing. I'm not real familiar with everything that is here. Or we don't have a lot of money for gas. I know there's an exercise facility in Clare, but I can't afford to go back and forth. Some quotes from our parents with young children. I really haven't found any friends, mom friends that are my age that I like. Yeah, I really haven't found any friends since I've been here. The bar, that's about the only way a parent is going to get any type of social interaction. Money is an issue. I never have enough gas to get anywhere. Like, that's why I miss half the play groups. I don't have a car, so I have to walk everywhere, and I don't have my license, so it's kind of hard to make it. Find moms off of Facebook because a lot of them want you to travel to them or meet halfway, and I'm not able to do that. Especially being a new mom, this is my first kid, so I don't know anything. It was stressful. And then our people with disabilities. It's difficult to find people sometimes that are on the same wavelength as you when you have pre-existing issues socializing. As someone who struggles with intense social anxiety, I find that a lot of events, if they are just held in like a classical style, it's just large crowds of people, it's very difficult to engage with them. One of the biggest difficulties is the way people assume that if you are seeking mental help, that you are mentally incompetent. There's an association where people don't understand that there's a wide range of emotional and psychological disorders that have nothing to do with your developmental capability or your personal cognizance. Like, you can be a very motivated, very intelligent, very driven person and still struggle with the mental illness. And lastly, it is very difficult to regain trust in your community when you feel like your community has fundamentally betrayed you. I'm pretty sure everyone here has experienced that moment at some point where it feels like you have been betrayed in some fundamental way by your community. And now you have to get past that well enough to come to the table and go, hey, I need to trust you now. So all of those quotes just exemplify the barriers that were given before. And now I'll just kind of go through how the barriers are complex and overlap with each other. And that comes into play, especially with forming and maintaining those social connections, accessing healthcare, and obviously transportation did come up a lot as well. So many of the barriers to social connection, healthcare, and transportation are interconnected. Transportation is a barrier across all three of these areas. People struggle to access healthcare, social events, and even basic services due to unreliable or costly transportation. Stigma also appears in both social connection and healthcare access, affecting people's willingness to seek help, whether for mental health, disability services, or even community engagement. A lack of public transportation makes it difficult for people to attend community events, further leading to social isolation. Limited access to technology and the internet means residents may struggle to find healthcare providers or participants in even virtual support groups. Economic barriers such as low income or high costs of healthcare and transportation force people to make tough choices, sometimes prioritizing necessities over social engagement or medical care. In rural areas specifically where these focus groups took place, communities often have fewer healthcare facility options, fewer providers, making wait times longer. And if someone lacks transportation, they may just forego care completely. Social connection is harder when there's a limited gathering space, but also when people are geographically just spread out way more. There seems to be like no easy way for people to meet. And then there's limited coordination between transportation services, which can leave residents stranded, affecting both their health and ability to maintain those social ties. So these trends underscore the complex interplay between healthcare, social dynamics, and transportation challenges in rural Michigan, highlighting the need for tailored solutions to address the multifaceted issues. I will share some more quotes from our focus groups that really highlight the intersection of all the barriers. For stigma, you must be dumb, you must be an addict, you must be criminal, you must be almost homeless just because you have a mental disorder. There are days because of my disability, I just can't participate in social events, and that's frustrating for me. For transportation, you may have access to a vehicle, but if you are very low income and with gas prices being the way they are, you can't take yourself, you can't afford to do that. That run to Grand Rapids is going to kill you. Do I eat or do I go? Yep, I just missed the appointment. I don't have a choice. For lack of providers, that left me with having to drive to Lansing, which is tough, especially if I have like 4 different appointments in 1 week. So the gas and the distance and everything, there's a shortage of doctors. If you're interested in reading more into our focus groups, we have a full report available online, so you can access it through that QR code. And you can really get an in-depth look into all of the participants' feedback and the results that we gather from this focus group. All right, and I will pass it off to Donna next.
Yeah, thank you, Kianna. So I think you can see that from those focus groups, we really gained quite an in-depth understanding of the issues and barriers that people are experiencing when related to trying to get connected socially or feel like they're part of a community. So the big question is, what can we do in our communities to improve that situation? It's not always true that people isolate themselves by choice. There may not be accessible parks or places that promote social connectedness in the community, particularly in our very rural communities. And I'll give you an example of when I was working with a community and we had a trail and someone decided put a park bench on the trail. And so as it turned out, people started sitting on the park bench, and then people would stop along the trail and they would talk and they would have a conversation. Whereas if the bench wasn't there, people probably would have not even connected together. So just something as simple as that can really help in your community to make social connection. And there may be norms in your community that make some people feel unwelcome at social events, like you can see from the remarks from the focus group participants. And social determinants of health, as Kianna said, play a big part. So poverty, not having enough money for gas or to attend an event, lack of transportation, those kind of things. So a lot of interplay and complexity with how do we work together to increase social connectedness in our communities. So here are some actions from an action guide that was created by Healthy Places by Design. So their suggestion is, one, weave social well-being into your organizational and community cultures. So even at the organizational level. So if you integrate social well-being into all your policies, practices, initiatives, and conversations, that can help your communities thrive. And just as simple as at your workplace, promoting social connectedness within one organization can make a difference. And also, they recommend incorporating social connectedness into community health improvement plans and community health assessments. And District Health Department 10 and Central Michigan District Health Department, we have just completed our My Thrive Community Needs Assessment for 31 counties. And so mental health and access to care were two focus areas that were prioritized across all of our counties. And so we plan to actually include some objectives or strategies to address social connectedness. It will fit underneath the mental health priority or the access to care. So we do plan on working on that action step. And then action 2 was honor community assets. So this picture that you see on the side there, I found that's a picture of the Scottville Optimist Park and Clown Band Shell. And that is a focal point for social connectedness in Scottville, and they feature all kinds of performances and events throughout the year. So that's an example of an asset in your community that helps create social connectedness. The cursor won't go. There it goes. So another action is to implement community-led and community-based solutions. So ask the community what they need. Invite residents to not just to join your group, but actually maybe take the lead on something intended to improve their lives. And offering small mini grants to resident-led projects can improve social connectedness. And this picture is an example of a program project that was in Cadillac. Cadillac has a leadership group every year that picks a project. And so they selected Club Cadillac, which is the community mental health clubhouse. And they did fundraisers to raise money to help give them a greenhouse and a community and a garden right on the site at Club Cadillac. So the club members, this provides them a place where they can go. They share in working in the garden, and they also share in the harvesting, and they use the produce. They have a lunch service snack bar that raises some funds for them, and they use that produce in that. So that was quite a great community, and it got the word of, it gave some recognition of Club Cadillac in the community too. So connected them with the community, and community members came to the kickoff when the greenhouse was actually built. And then focus on using a systems lens, seeing the big picture. That enables us to have the recognition of our interconnectedness. Look around you, where are we interconnected? And just know that every sector and resident has a role to play in creating inclusive and relationship-focused places. So having diverse partners, partnering with people that you may not think, it's not just our traditional health partners that have a stake in this. We have in our Shire Steering Committee, we have disability networks, we have community mental health, we have area agency on aging. You can bring in your local government, your decision makers. Everybody has a role to play in creating socially connected communities. And then action 5 is really important. Make sure you allocate resources. So when you find those assets in your community, build on those assets by creating, allocating more resources to those. You can prioritize your resources and funds for those community assets. Examples are like your community centers, your parks, your libraries, youth programs, and then even frontline services such as mental health, housing, and substance use services. So now I'm going to say to the group, I don't know, Patricia, can people talk on this?
Yeah, I think if people would like to participate,
Or they can put in the chat.
They could put it in the chat, certainly.
Yep.
Or I also think they could raise their hand and then I could give them the ability to speak out. So both of those options are available.
Okay. So we wanted to ask, do you have things that you're working on to build social connection, or that you know of in your community that some group is working on to build social connection? Are those opportunities, are you aware of any right now? We're trying to collect, I guess, data on, what's going on in all of our communities that we could help assist with. And I can't see the chat, Patricia, so if somebody can read it.
Yep, I can see that. And I'll just get us started by talking about our series. HumanKind has been focusing on this. As West Shore Community College, we've been looking at it from a lot of different disciplinary angles and hosting these conversations more broadly in the community. And we've also been reaching out to our community partners. So we've been working with other organizations like the Scottville Senior Center and like the public libraries. So I'd love to hear you mention public libraries as partners that were maybe not traditional for public health, but they do have that place where they can intersect in this area of connection. And I think libraries really have a strength there in facilitating that connection among all the community members across these barriers. People from all age groups use the library, people from all backgrounds use the library and are welcomed here. So it provides a great space for those kinds of social interactions to happen naturally. So thank you for including libraries as partners in that. I think this is work that they're deeply committed to already.
Yeah, I love to read, so I go to our library in Cadillac. I'm there all the time, and every time I go to get new books, there's a group. I mean, it's packed with, parents. There's kids programs and all kinds of programs in there, and it's such a lively place.
You're right. That is.
So yeah, libraries are awesome.
I think too, for our communities, highlighting the activities and events the Great Start Collaborative puts on, especially we saw in the focus groups, parents talking about not being able to connect. And so how can we do a better job of sharing those resources or helping new parents or young parents connect with each other?
The thing that
Also
struck
would
me
say-
again, and I had heard you all speak on this before, was the common barrier, first of transportation. You did a great job of addressing the rural area that we live in, and things are spread so vastly apart, but also the barriers of awareness and knowledge across all of those different age groups. That's something that stands out to me as a librarian and as an information professional. How are we sharing information successfully, and how can we leverage these partners to share our information across those different groups and kind of break down some of those barriers? So that's something I'll continue to ponder and hopefully continue to collaborate on with you all.
I think speaking to that too, like acknowledging the different formats we're sharing, because it's easy to share events on social media, but are we really capturing everybody who could be invited to that? So thinking like some older adults aren't on social media, and then the broadband challenges that we have throughout our area, they might not even have access to affordable internet to even see those posts on social media. So being sure and working towards sharing things on different platforms and formats.
Yeah, that's a good point you bring up, Erin. I just had an example of that. I'm president of a NAMI, National Alliance for Mental Illness affiliate in Wexford, Mesaki County. It's part of NAMI, Michigan. And we try to host support groups for people with mental illness, and also family members if they have a loved one or a friend with mental illness, a group where they can come together and share. And we promoted it on our Facebook page and sending out emails, and didn't get people coming to our group. So ended up a reporter called and put an ad in the paper or a press release. He did an article about it. And so we had a family community learning event where we were asking families to come and tell us what their needs were. And he put it in the paper, and we had 5 people show up, and I asked where they saw it, and they said, we read it in the newspaper. So you can't always count on Facebook. So what ideas, if you're thinking outside the box, can you come up with any ideas that you think would build social connection in your community that we haven't talked about? I know there's, some innovative ideas out there I've heard from people.
I feel like I'm bringing my lens of working so much in libraries to that, like you're saying, libraries are a much more active environment and, hosting things like story time for new mothers, hosting reading groups where people from all different backgrounds and age groups are coming together, but all of those kind of events that are core to services of the modern library are bringing those people together that otherwise wouldn't have met, and I think there's a lot of beauty in that, like kind of organic community building that's happening.
And what I hear from a lot of people, once people are, out of school and in the workforce, and people have families and things obligations with their family. And so I've heard from a lot of people that it's really harder to make friends when you're older, that people don't get together as much for social interaction. So
Yeah, that is something else I've thought a lot about, Donna, is people feeling busier than ever. Feeling pulled in so many different directions with all overwhelm of information, right?
I was just putting into the chat, like similar to what you guys were talking about, creating spaces or some kind of way for young professionals to connect and meet, especially if you're new to the area you're working in. Having those social connections in a community around you can really help you feel like rooted here, or start being more familiar with the area. There's a lot of new people who move to the area and they're maybe not finding that. So how can we start to create those spaces for young professionals to connect and build that community? That's something that I was thinking about, which aligned with what you guys were just mentioning.
I think along that same line, we sometimes overcomplicate things, but I mean, if our young professionals new to a community, they have hopefully right access to transportation and things, so they're getting around. But are we taking that next step of being like, okay, I'm going to go talk to a stranger today because I want to build community here, right? It has to be something that you also at times have to strive for in your own life. And that can make a big difference.
That little nudge out of your comfort zone. That reminds me of what Donna was saying, putting that park bench. And I think there's a lot that could be done, especially in rural areas, with parks and having some really intentional kind of pathways or places where people can walk more easily and be out and maybe have those opportunities to have social interaction as well.
yeah, I think about when I brought a person to our community, Dan Burden, was kind of the guru of walkable communities, and he really made the point that we have designed our communities around the car. And so everybody drive, everything's, big parking lots instead of parks, and not places to walk, but make sure the roads are 4 lanes wide so traffic can go fast. And that's an issue. We got to look at even the way we really design our communities, and also looking at, we worked a lot on safe routes to school programs where kids could be safe walking to school. And what we found when we surveyed parents, they said they wanted their child to be safe walking to school. But when we surveyed the kids about why they wanted to walk to school, they said, I want to walk to school to have more friends. I want to have time to be with my friends. So it was a social thing with the kids. So yeah, just something simple as they did a lot of then walk to school days where, you know, a bus might drop kids off at a remote site within walking distance from the school, and then the kids all walk together. And kids love that. Well, thank you for good discussion. Any questions anybody has?
And you can
Feel
put those
free to
in.
put them in the chat if you don't want to unmute yourself.
I did put links in the chat to the Surgeon General report on loneliness and isolation, and then the link to the website for the action guide to building socially connected communities, and the focus group report from all the counties that Kianna shared the data on.
Thanks, Erin. And feel free to contact any of us if you come across any ideas that we can support you with. We're there to support any initiatives that you think might be worthwhile to help your community.
Like we have a small participant base, but I'm sure they could reach out with questions if they have them in the future.
Okay, thank you.
So I want to thank you all for being here today and sharing your time with us. I think this is a great lens with which to look at our social connection and how we overcome loneliness. So thank you all for joining us today.